Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, back in the studio with Hawkeye. We're here in the Dolph Simons Family Studio, broadcasting live with you, talking about all things Corona, COVID, and other. And today we have a really great program for you. We are joined this morning by Dr. Erin Corriveau, who's the Deputy Medical Officer of the Unified Government Public Health Department. She's back with us to talk about things that are going on in the DOT. And she's joined by Pastor Glenn Brady of New Bethel Church here in Kansas City, Kansas. He joins us as well to talk about how things are going for his group and his congregation around coronavirus and about the community, because I know Pastor Brady is very active here in the Wyandotte community. But first today, Hawk, I think the count's pretty good, a little higher, but man, yesterday got down to 13.
Yeah.
That's great. Today?
Yeah. Today is 18, so it's been about where it was when we left on Friday.
Yeah.
So throughout the weekend, we've had people who have discharged. We've had people who no longer meet the criteria for active acute infection, but more in the recovery stage. So that is really good. So 18, it's a lot better than where we, mid-20s, mid-30s, so I think we're doing well. But again, in that number, we have had discharges. Unfortunately, there were 6 admissions, so we are still getting higher than we would like admissions. We just have those other people who are either discharging or not meeting criteria. We have 4 of those people in the ICU and 2 of those on the ventilator. We still do have 2 people who remain on the ventilator and are considered in the recovery stage as well.
So why do you think the numbers are down? Because clearly better than, last week we got up to 39 or 40, and now we're down at 18. What do you think is making that difference?
Yeah, I have to believe that it's mostly with the demographics of the people that are being tested positive. So certainly in that younger age range, so below 50, below 60, and then again, even in the 20s to 30s especially, is one of the major reasons why we aren't seeing the hospitalizations like we were initially when you had a lot of the nursing homes, but also you had other people in congregate living like the prisons, things of that nature. So I think because of the demographics, really of the age, we aren't seeing the hospitalizations that we saw in the initial parts of the pandemic.
Yeah, I think that's probably right. But I'm also going to send a compliment out because I think it's partly people are wearing masks and doing better around infection control. Yeah. You go into businesses and there are a lot of masks on. We'll see what happens. I'm still a little nervous about the bars and the restaurants, and they're a little more crowded. And now schools are reopening today, so that's a big deal too. We'll see how that transmits. So I don't think we're going to really know what this all means to probably early to middle of October.
Yep.
I mean, we know it takes a 4 to 6 week period for major events to spread out into that second or third order of spread and get other people infected. So I think it's really going to come down to what happens here in the next 4 to 6 weeks. And we'll know more still about colleges reopening and about schools reopening and how things are going and what that means. But if we get down below 10, down below 5 especially, I think you and I are out of a job in here, and I think that's probably a really good thing for the public, don't you think?
Absolutely.
They don't have to hear us singing or watching any more superhero videos or, pow, bam.
Freezer videos,
Freezer videos. Like we don't have to. That'd be pretty awesome.
Our message has gotten out there. So I do think that's important. The other thing is in the summer, even though people were getting together and we saw a lot of pictures and videos from the Lake of the Ozarks and things of that nature, the one saving grace from that, just as with the demonstrations, was that it was outdoors. And certainly I believe there were probably more people wearing masks in the demonstrations, but at least those other parties and get-togethers, as much as we said, meet in groups of 10 or less, those were outdoors. I think that helped a lot compared to, we know that indoors, especially the documented cases that we've seen of in the journal articles, do have higher rates of infection.
Love to see it go away. Of course, that middle of October, we're going to be seeing a lot more influenza then, too. Whatever happened out in Great Bend, did those cases turn out to be positive for influenza?
We only retested one, which was thought to be a co-infection with influenza. But again, activity of influenza around the nation, and particularly in Kansas as well, is very low. That was there was a confirmatory PCR test, which was negative. So.
Yeah, so keep those masks on. It's working, and it's going to help with influenza. Dr. Corriveau, how are things in the DOT?
Morning.
Good morning.
Yeah, we're doing okay. It's been, you guys are talking about lower numbers. we're seeing that as well, which is a good thing. But we're still concerned that not enough folks are coming through to be tested, actually. So we're wanting to really encourage people to come through, especially, if you think you've been in contact with somebody who is positive for COVID, we still really, really want to test you. So come on through, free testing at the health department as per usual.
All right, excellent. Pastor Brady, how are things with your congregation? How are people staying healthy?
Well, thank you, Doctor, for having me on this morning. Yes, we're doing very well. From the very beginning, we took the attitude of wisdom with faith.
I like that.
Of course, we're faith believers, and we know what the Lord can do. But at the same time, I think we have a responsibility of using wisdom. So from the very beginning, we shut down our services and have not resumed a full service to this point. So I'm appreciative of you and your colleagues who are keeping the public abreast, and we're trying to follow the instructions that you're giving.
Well, thank you. And, I think my church, Community Christian Church, did the same thing. We are out there and doing our Zoom and just pretty cut it down. It's pretty cool. And I know that groups are doing a great job at trying to make sure people. So I love your point. There's grace and there's wisdom, and we have to be thankful for both of those. So that's awesome.
Absolutely.
All right, Jess, I know Jill is still on vacation, so Jess is here with us this morning. Let's see if there's any questions from media. I'm not hearing any of that. So, Jess, I bet there are going to be questions from our listening audience stored up over a 3-day holiday weekend that was outstanding. And just to say, before we depart today, we have to get everybody's predictions for Thursday night.
Yeah.
And I'm not going to talk about what time the sun sets, talk about Chiefs football.
I love that. Okay, so, school just started today, so you're going to get a few school questions. So,
All right.
Travis, he says, with school in session, any signs or symptoms I should look for initially for my kids? I'm really concerned about them being asymptomatic.
All right, let's deal with that one. Dr. Corriveau, I know you're a family medicine physician. That is right up your alley.
Well, it's also, though, a tough question, as you know, Steve. So
That's why I dished it to you, Erin. Let's be honest.
Thanks a lot. So early on a Tuesday after a holiday weekend. I think that is a really valid concern. We know that our kids can carry this virus and spread the virus, and we know that they also don't get as sick. They don't land in the hospital as often as older folks, as we've been talking about for a long time. One of the things that we're really trying to drive home in Wyandotte County is this idea of cohorting. And, I think what I would just be aware of is, talk to your kids about sticking with that same group of kids that they're within their classroom. And then on the off times, when you're not in school, we want you guys to be really careful, about what you do in the evening times, on weekends. And if your kids are involved in activities, we really, really encourage mask wearing during those activities. Sometimes you can't tell, but we have really strong rules in place so that if we do find a positive case, we're working with our school nurses very closely at tracing other kids who may have been in contact with those positive cases. And so we're doing really the best we can. I can't say enough about our educators and our superintendents in Wyandotte County. They've all been so very helpful. So good question. Sorry, I don't have a perfect answer for it, but I think that it is a really big concern and valid concern.
I think it is, Hawk. And I think just things like fatigue, not having the same energy, low-grade fevers, a little bit of cough, or sinus drainage. And unfortunately, that's like every kid at some point during the week, right? And so you always have to be on the lookout.
Yeah, absolutely. This is the second Saturday in a row I was called by some friends about them being positive. I had some dear friends call me. First, the husband had symptoms of sinus drainage and some cough. Wife had cough and was feeling bad, mild. So we have to understand that a lot of these symptoms that we're talking about can overlap with things such as influenza, such as the common cough and cold. And to Erin's point initially in her statement about testing that Wyandotte County is doing, that is going to be a big thing moving forward. And I think as we get further into this, we need better access to testing. But I think we are on the cusp of that, not only with the NP or the nasopharyngeal swabs, which we've been using, but also the saliva rolling out to the masses for asymptomatic or symptomatic. We aren't there yet. But then also the antigen testing, and particularly because it is such an easy test, if you can get access to that for the asymptomatic people, where you are looking at it and you have frequent access to be able to get it, if it's negative, really it's a very good negative predictive value, saying that if it's negative, you probably don't have it based on all the numbers and the statistics, because what they really think is that if the antigen testing is negative, you probably don't have enough virus to be contagious anyway. So we are working towards that, and I think moving forward, really access for the general public for asymptomatic or symptomatic testing is going to be very important.
Yeah. Pastor Brady, as you've talked and counseled your congregation, and I know there had to be a lot of questions about school, tell us about some of the attitudes about returning to school amongst the parents.
That's a very good question. And even our church, we had a forum that we invited those from the health department, the school system, administrators, counselors, and we had a forum to help our congregation know how to prepare for going back to school. As you know, some students are in person, others are doing virtual. And it's not only the students, it's the pressure on the parents as well, especially when you have single parents and they're trying to balance between work and still making sure that they're home with their kids. So we've had a lot of great conversation. And I think there's not just one perfect answer. Everyone has to adjust to their specific situation. But we're certainly trying to provide as much information as possible so people can make intelligent decisions.
Yeah, there's that wisdom thing again. We can find some. You know, I think that's what we've been saying to parents all along about going back to school, Dana, is that really it's a highly personal decision, and you've got to make a decision about the health of your bubble and a level of risk you're willing to accept, because it can change for everybody. And, you know, if I have 3 kids, they're older now, but when we were younger, they were pretty healthy. I think we could have probably said, okay, we can go back to school. Yeah. But that's not true for everybody. I know. Right. You tell us about how you went through, because you've had to think about that for your kids.
Absolutely. Individually, for myself, it's, probably if I got infected, I would be okay. But you never know. You roll the dice with this infection, especially as you get, above 40, 45, 50, up to 60. And we know above 60 is certainly higher risk. But then that would mean that I would have to be off work for 14 days. So that's the other thing. So even if you don't get infected, there are parents who are out there working who need to be working, who can't be quarantining at home. Here, I don't have a lot of other contact with, family members that are high risk or anything like that. So it is, judging the risk and how can we best maintain what we can do. It's also teaching the children what to do about trying to maintain space as much as possible. It's obviously easier for older children rather than it is for the younger children. But it's thinking about those types of things, because missed work, even if you're not sick, if you're having to quarantine, is not good either. So it is all about those individual decisions. And I think, from what we've seen, kansascity.com, the rolling 7-day average of infections in our community
it's gone down.
Is under 300. So if we can keep that trend going, that will make it a lot easier to make those decisions to get back to school. It will also make it easier to meet the gating criteria for the kids who are not doing in-person learning to get back to school and do that in-person learning as well.
Yeah, for sure. Jess, what do we got?
Okay, so Kevin says, we've heard of outbreaks in nursing homes. Have we seen anything like that in churches, either locally or nationally? Are they enforcing strict masking policies?
All right, well, the answer to that, we know, Dana, is yes. Churches are still, those that are still congregating together, are still often hot spots here in the state. I was just talking to Lee Norman the other day, the KDHE secretary, and they're still having to go to investigate churches which are getting together in large groups and not having social distancing, and sure enough, they're sharing the virus.
Yeah, absolutely. We know that it can be done safely. People want to get together and congregate and worship or celebrate or grieve, whether it's weddings or funerals or just a weekly church service. It can be done safely, but we do know that clusters And outbreaks have been associated with all of those types of get-togethers.
Pastor Brady, how have you handled your services? Because you said you're trying to keep everybody safe. How's that been going? And then I'm going to talk to Dr. Corriveau for a minute about it, too, across the community.
We've been very successful because we do an alternate service. We do virtual, and we do an outdoor service. And, of course, being outdoors, less of the chance of the virus being able to be spread. And when we do virtual, we do allow a limited number of individuals to come in the sanctuary while we're virtual through social media. So through that, both the social media and the outdoor service, we have been very successful.
Hey, there's going to be some fall-like weather coming in, so people have to bundle up a little bit more this week. Although I think next week it's supposed to be pretty nice. It's going to feel good.
But again, it's been very hot. On the opposite side, it's been so hot that people did not want to come out. So I think we can find a good balance.
Oh, that's probably true. It may have kept somebody, maybe it kept them safer. Who knows? Dr. Corriveau, tell us about how things are going on in Wyandotte County for church services in general, and really just for congregate, and I don't mean congregation, but any place people are coming together. We still seeing the spread of the virus.
We are. We've had a few outbreaks. We're really looking, at workplaces, especially right now, and seeing some further outbreaks there. But we've got a great team of epidemiologists that's, very quickly kind of jumping on those situations and trying to keep people safe there. I just can't say enough also about Pastor Brady. I just want to bring us back to Pastor Brady.
He's a pretty good guy.
He is such a great guy. And, we've been working with him, and he's been helping to advise us at the health department now for many months, really since this pandemic started. And, he and other pastors in Wyandotte County have worked really hard together, I think, to understand the virus, to ask really, really hard questions of us, and to point out some of the places where we needed to get, tougher, and we needed to be stronger and better at the health department. And I think that he's taken the information then right back to his congregation. And, we've just seen that from him over and over again. So I just can't thank him enough. We were hit really hard initially in Wyandotte County with spread of the virus within a couple of our churches. And some of those outbreaks were extremely devastating. And I think that information was really taken to heart, and we're really proud of some of the messaging and the help that we received from our pastors, including Pastor Brady.
I know that influence of the pastors and KCK is incredibly important. Pastor Brady, this has been the summer of special stress. We have a pandemic. We've had racial justice issues, which have been legitimate and needed to be raised. And then there's been economic hardship. How has your congregation, how have you handled it? How has our community handled it at this very difficult time?
Well, that's a very good question, Doctor. And the issue that we look at always is finding truth. And there's so much out there that we don't know what is true based upon even those in leadership. But that's where a spiritual base comes in, that we can get solace and comfort through the scriptures, having messages that are pertinent, helping individuals go through this process. Yes, it's been stressful, even on me as a pastor, and I'm sure as you as a physician. But we have to sometimes just take a breath, step back from the situation, and still realize the blessings of God on our individual lives, and do not allow these other outside circumstances to overwhelm us.
Take a deep breath. That indeed is a good thing. Yeah. Dr. Corriveau, talk to us a little bit about the effect of stress in a community where there's long-term stress. We know that really affects health outcome.
Yeah, we do. That's a great point. Another thing that we've been working on since the beginning of this pandemic is we see incredible inequities in our community, and some major disparities that I think are just magnified right now during this pandemic. The stressors on families are real, as far as the economic stress that you've talked about, some of our families have single parents. They're struggling to keep their kids in school and also work. And these are all real issues. And I think that the parts of the community that they affect, it just is another burden upon, this massive pandemic. And you talked about racial justice issues, which are, I think it's good that this stuff is coming out. We're actually working with our health equity task force in Wyandotte County to always seek the advice of our leaders from our community organizations and our churches and other groups that are really interested in seeing these disparities disappear within Wyandotte County. So I have to say that that's been a great thing for our health department. But another thing I wanted to say is that we've really tried to not separate, getting this virus with other services. So we wanted to put together, those social services. If you need help, in the way of food, housing, other interventions, medical bills, whatever, we are systematically calling folks who have been affected by this virus within our county and getting them help through our community health worker program, through other community organizations. And so we're really trying, and we're always open to creative suggestions if you guys have any from the community or from you there at the university. We're always trying to do better.
Thank you.
Dr. Seitz, I have a couple of questions from the media, and the first one's from Charlie at 41, and it's to Pastor Brady. He says, I remember seeing your church's drive-through blessings on Good Friday. How important is it to you to stay connected to religion throughout these times?
Yeah, there you go. What a great question, Pastor.
Very good question, and absolutely. See, we're rooted in faith, and when we cannot come together as a congregation, my emphasis is that you still have to have that personal relationship with God. And you cannot forget your foundations spiritually. We have taken a lot of steps to ensure that people still can be connected, outdoor services, we provide food for the community, we do giveaways, but you got to still have that fellowship connection even beyond just the virtual. And the real emphasis is you must have that personal relationship with the Lord and get your guidance and your direction from Him.
Cody from KMBC Channel 9 asks, and this is for everyone on our panel today, what is the number one thing you recommend parents tell their kids as school begins?
Okay, I know what my answer is going to be. All right. Dana, what's yours?
What is the number one thing we tell our children? I think it's a combination of things. Again, it just goes back to the main pillars that we're talking about. Try and separate yourself from your classmates. It doesn't have to be obvious, but do that. Keep your mask on, and that's all in one kind of grouping. I think the other biggest thing is that everything will be okay. We are here for you. Your teachers are here for you. Everything will be okay.
Pastor Brady, what's the number one thing you would tell kids today?
Of course, I'm not from the medical background or that expertise, but I would remind our kids to be courteous one to another. We want to make sure, and see, part of being courteous and considering your classmate is social distancing, wearing your mask. It's not just about you, but you have to remember you can affect your classmates, and that's just in school and in college. So from my perspective, it would be make sure you're courteous to your classmates.
I love that. What are you thinking, Dr. Corriveau?
I'm thinking for me, masks win big time. So I'm going to say simple act of kindness, masks up all throughout the day. You guys can do it. I hope you've been practicing at home. It's not that bad. It's pretty cool, actually.
Mm-hmm. Well, when you ask that question, the first thing that came to my mind is to say, I love you.
Mm-hmm. Yep.
Because that's the first thing I start with my kids every day. And they were over for dinner last night. They're inside our bubble. We long ago established that. I still give my kids a hug. It's a brief hug. And say, I love you. Because, I think at a time like this, when there are so many stresses in the world, both around racial and social justice, which is so important. A pandemic which just eats away at all of us and causes cows, COVID weariness syndrome. Economic hardship for people trying worried about their work and whether the business is going to stay open. I think those three words, I love you, mean more than ever. And I think our kids need to know that they're loved and that their parents care deeply about them. And hopefully that will give them the security and the ability to follow the things we ask them to do. Be courteous, show kindness, and show the greatest act of love, which may right now be wearing a mask. Because wearing a mask is just a way to say I love you. Because that's how we take care of each other.
So a common question about travel this morning. Lindsay says, realistically, we cannot stay apart from our children and grandchildren. And if flying is the only option, how do we safely travel to get together with family that we have not seen in so long? How high risk do you feel flying is if we're seeing a downturn in cases?
Yeah. So first, I just want to be careful about the downturn in cases. There's a downturn, but there's still cases. So the risks are still there. Let's not get cocky. Let's just keep our game going, because we know that even if we're in the third or fourth quarter of this game, if you start letting down your guard, coronavirus comes roaring back. So don't get cocky. But I think the key to that, the answer to that question, Dr. Hawk, is that we all have to decide what our risks are, what our risk tolerance is. You know, I see my kids, and my daughter lives in Chicago. I had a Zoom call with her yesterday. Told her said I love you to her, and you know, I think we would love for her to be able to come back and spend a few weeks with us. And I know she works hard at staying safe. And if she came back home, probably try and get her tested. But then I think, you know, I'm good with that, because you don't get to see your kids enough. So I think you just got to find the place that you're comfortable with, that you and your family can accept the level of risk and establish as low a risk as possible.
Yeah, I mean, and to your first point, and again to Erin's first point, it goes back to the testing. So we did say that there was a 7-day rolling average, is less than it was, but that's a consequence of the testing. So is everybody getting tested who needs to be tested? Are we having access to testing? So it is good, but understand that it is a function of the testing. Can you travel safely if flying? I think you can. There is always risk there, but if you are using adequate hand hygiene with hand sanitizer or with washing your hands.
Hey, look at you on that plane back a few weeks ago.
That was a long time ago, though.
But you're still doing it right. I don't know what that black muscle shirt's doing on there. That's kind of good.
That's just a T-shirt.
Okay, whatever. But it also got the mask. You got your goggles. I bet you're wiping the place down.
Yeah, absolutely. I have my hand sanitizer with me. Obviously, I had a face mask and eye protection. So if you're doing that, and when you are waiting in the TSA line or waiting to get on board the plane, try and distance yourself as much from people as possible. If you can do those things, you're going to reduce your risk of getting the disease.
You know, the other thing I would add to that is I have a lot of patients who've had a lung transplant or cystic fibrosis. And, you know, I think when you're immunocompromised or you're sick or you got a chronic illness, you have to be a little bit extra vigilant about what you're going to do, not going to do. I tell my transplant patients they need to wear a mask. I need to wear an N95 mask. And I'm not sure that's an official recommendation, but the thing about masking is that it prevents the germs from you getting to others.
Right.
An N95 mask protects you what you breathe in. And I think for a transplant patient, that's a big deal. And so I think it depends on your level of concern. But that's the approach I would take. What do you think about N95s on planes?
Yeah, I think it's hard. You know, the biggest thing in the healthcare setting is for N95 masks, you really have to be fit tested to make sure they fit correctly to protect you. We know that the cloth face mask, especially the 2 to 3 layer cloth face mask, can provide some protection. You know, walking around the stores, there are some stores selling surgical face masks. I'm not sure how those are validated and vetted and if we would be using those in a healthcare setting. But really any one of those things, and if you can get fit tested for an N95 mask, that might be reasonable as well. But any one of those things is really probably it will definitely help you more than not wearing one.
And by the way, to our listening audience, I want to make sure that everybody takes the cold weather challenge. Okay, so we've been going to the freezer, but this week we don't have to, because in the mornings it's going to be a little chilly. It gets down to those low 50s. You can walk outside, your breath will be warm in your mouth. Breathe outside and see how far that breath goes, because that is your breath cloud right there. Look at him go with his nose. That's just from his nose being down.
Yeah.
So just remember, If you don't have a mask on when you go outside, you got a breath cloud, see where it is. Then put a mask on and see where it is. You're going to tell it's a heck of a difference. So do yourself a favor. Take the cold weather challenge. You'll prove to yourself how important masks are.
Okay, so on that topic, this viewer asked, if masks are so effective, then why are students who are wearing masks at school still required to quarantine when they might have been in contact with someone who tested positive in their classroom?
Okay, Hawk.
I mean, great question.
It is.
Again, none of these things that we are talking about are 100%. What we are talking about is reducing the risk. Reducing the risk of you spreading it to others, reducing the risk of you getting it. Again, we know that there is the third mucous membrane. You have your mouth and your nose. The third mucous membrane is your eyes. You can still contract the virus through the eyes, especially if it's in the droplets and it does land in your eyes. Your eyes, the lacrimal ducts do drain down to the respiratory and the sinuses, and then you can get infection that way. Even that one researcher who studied Ebola and who studied HIV, he felt he got it on the plane. He was taking all the precautions, but he didn't have eye protection. He felt he got it through the eyes. So all of these things that we're doing talk about risk reduction, and you can reduce the risk as much as possible. But if you are out in the community, if you are in these places, there is always a little bit of risk. Now, we have a little bit of respite because we did see from that CDC publication, again, we go back to the hairstylists who were close in proximity to their clients. 2 of them had COVID-19. The 140 clients did not. They both were wearing masks. And there was no obvious transfer of the infection from the hairstylist to the client. So there is very good data to suggest that wearing the mask by both people will help, but you never reduce that risk to 0.
And I think in the situation, Erin, of a school, one of the things will be that if a person tests positive, do the other people in that bubble need to be quarantined? I think the answer is partly yes, because you're never really quite sure that everybody wears the mask all the time. Yeah. And number 2, masks protect your stuff from going out, not necessarily from what you breathe in.
Yeah, that's exactly right. And so we would want to quarantine that small bubble, or cohort is another word for that we've been using a lot. And I think that, Dana really got it right. It's not a perfect 100%, reduce the risk of spread of virus when you've got a mask on, unfortunately. Those N95s are the best thing we have, with that 95% risk reduction protection there. And then, paper surgical masks we think are pretty effective. And then, the cloth masks a little bit less so. They still help a lot, and especially if both people in the situation, are masked. If one is positive, if both are masked, you get sort of an extra boost of risk reduction there. But, yeah, we're trying to be really, really careful with our kids, and so we may have to quarantine kids, even if one is positive, and we've still been wearing masks and social distancing.
So, Pastor Brady, here comes the tough question for you. Do you wear a mask when you go out in public?
Absolutely.
Good
Absolutely.
man. I love that.
I wear a mask. Our family wear a mask. I have a 2-year grandchild, a granddaughter, and she wears a mask. So my wife's an RN, so we're very health conscious. And I must say also, Dr. Corriveau and the entire staff at the Wyandotte Health Department are doing an excellent job, and they are the ones that is constantly reiterating, do the right thing. We're following their direction. But to answer your question, yes. Now, if I'm in the car, our social bubble, no, I'm not wearing a mask.
Yep.
But if I'm out in public, absolutely.
Yeah, I'm right there with you. That's exactly it, I think. Now, I heard a little baby in the background. Whose little baby? Where was that?
That was my granddaughter. That's Amelia. She's staying with us for a few days. So, yeah, that was her.
You tell Amelia we said good morning and hello.
All right.
All right, so back to church. So thoughts about choirs in church services.
Oh, choirs at church services. Is
it safe to get together and practice for about an hour or so?
Practicing for an hour, Pastor. What do you think?
Well,
I think Dr. Corriveau's shaking on that question, but you start.
I'm going to let Pastor Brady open this one up. You know how nervous I am about singing, though.
Uh-huh.
So, yeah.
Well, from our perspective, we do not have anyone basically in the sanctuary. So it's just the worship team and the band members. They're wearing masks, but we are safe distancing even while we're singing. But we do have singing as very much a part of our worship service. That's why we don't have a live service, and most of the worship team are in a bubble. We do testing prior to anyone coming into the sanctuary. We test their temperature. We do trace information, so if we have to go back and do contact. So we have singing, but we don't have a full congregation. So consequently, we have safe distancing, but it is very much a part of our worship service.
Oh, that's good. That's kind of where ours is as well. And the only problem is it means I can really hear myself when I sing, and that may not be a pleasant sound. I'm not sure. I'm not sure how good that is. Hawk, what are they doing where you go?
We still are not using choirs at this point in time.
Yeah.
Really, in service, there's not a lot of singing at this point either. I think, if you are separated and distanced, I think it can be safe, but right now in the current state, it's probably still a little bit risky, especially if you are having choirs, 6, 8, 10 people together.
And I would say choir practice right now, if they're together, is just a bad idea.
Yeah.
Just a bad idea. I would not do that. Dr. Corriveau?
I think I'm with you, Steve. We have encouraged our churches and also our schools to do singing practice and also, instrument practices, especially like woodwinds and horns and stuff like that, to just do that outside, and I think it sort of matters about how you're positioning yourself too. We wouldn't want people sort of circling up and singing toward one another.
Right.
Or lined up too closely and singing over, one another in a tiered sort of way or anything like that. So we've been pretty strict on that. And the real worry is that there's potentially particles are spread further and potentially even aerosolized particles. The louder we speak, or if we were to yell or to sing or whatnot, it just increases your risk.
Yeah, exactly. This morning I was out exercising. It's kind of the same thing, really, and we were well spaced apart, 20 feet each, and it was an exercise class, always outside, and the wind was blowing. Yeah, I was like, okay, totally safe like that, right? It's just makes a huge difference.
Dr. Stites, would you like to share the John Denver song that you sang in the freezer last week? I think I heard
there
that.
There may be a John Denver song that pops out sometime during this week, indeed. I do love that song, Take Me Home, Country Roads. We may have modified that tune a little bit this week. We'll see how that goes. You may see that Thursday, I think. Is that right?
We'll see.
I think there may be some to it come
real
Thursday.
you comes out.
Little tease on that. It's coming.
Okay.
Take Me Home, Country Roads.
That's right.
I'm looking at you, Patrick Mahomes. Okay, go ahead.
Okay, so Jennifer asks this is about testing. If we're continuing to increase testing in the community, how does that overall keep us safe?
You bet. Dr. Corriveau, talk to us a little bit about the importance of testing.
Yeah, I guess just the act of testing per se, people are saying, why do I even have to do this? You guys are just going to tell me I have to go home, and I can't go out to work or the grocery store or something. And actually, that's exactly how it keeps you safe. So, the simple act of testing, if you've got symptoms or have been in contact with somebody who, has this virus, it actually helps us to identify those people who have the virus and then to isolate them so that they don't spread the virus any further. And that's the whole idea sort of behind the contact tracing thing and why we are encouraging as many people as possible to test. We've been working really hard with our schools and workplaces throughout this pandemic. So, if, for instance, you were saying, geez, I have a hard time because my workplace doesn't recognize this or that sort of thing, we will call your workplace for you. We will work hard to, help relieve you of that pressure. And so we want everybody, again, to isolate for those 10 days if you've got a positive test.
Yeah, so important.
Yeah.
Okay, time for one more question, Jill.
Jessica.
Jessica, gosh, sorry about that.
That's
I knew
all right.
that.
We're interchangeable. Okay,
Yeah,
so
J&J.
That's all right. That's close enough. So LJ, question for Pastor Brady: are churches requiring masks?
All right. What do you think? How is your church requiring masks when folks come in?
Yes, we do require masks. There's a protocol, again, for those that actually come into the service. Now, when we're outdoors, we do not necessarily command a person to wear a mask, especially if they're in their car. But if they do come into the sanctuary and they're not participating with either giving a singing or doing anything of that nature, yes, we do require everyone to wear a mask during the service.
Sure sounds like a great answer. Well, final thoughts, Pastor Brady, as we wind down today?
Again, I'm grateful for all of the attention that you guys are giving, and we want to certainly continue to follow your instructions. We are always putting faith first, but we all have wisdom with our faith, following the scientists, and we just want everyone to be encouraged and keep your spirits high and lifted up and know that the Lord is following you.
Thank you, and it's good to hear that thought that science and faith can walk together.
Yeah,
Absolutely.
Dr. Corriveau. Final thoughts?
Thank you, Pastor Brady. I want to just echo what you say, and I do think that you all are making a difference in our community by your mask wearing, by your social distancing, by being careful where you go and what you do, and we appreciate that. As Dr. Stites said earlier, don't let up now. We're looking really good, and I also want to issue a, congratulations. We made it to the opening of school, and we're going to do our best, but good luck to all our kids out there, and I hope you have fun in your first week back.
Yeah.
Hawk?
Yeah, I think for today, we've touched on this a couple times during the show, and it's all about the testing. So it is about testing not only the symptomatic people, the people who have symptoms, because then you would expect that there'd be a high number of positives, but it's also the other pool of testing, and that's the asymptomatic people. And the more that we test, the more we have access for people to get tests with timely and efficient results, we will get a better picture for really how much is that disease out in the community. We can make our gating criteria. We can get our kids back to school. But we can have a better handle on public health, but also individual health, to know that if you have a positive test, then you probably will reconsider going out to that congregation or meeting with other people until you are 10 days past that test. We can get a better idea for really how much disease is out there in the community. So it does go back to testing, both asymptomatic people and symptomatic people having access to that test and having timely results. And hopefully we are on the cusp of getting better, more efficient, and access to testing for the general public.
Indeed so. Hey, tomorrow we have a really cool program. Dr. Louis Satterwhite, who's a pulmonary critical care physician here at KU, is a great doc, good friend. He talks about life in the ICU for COVID-19 patients. And if you need a little bit of extra energy about why you want to wear a mask, come listen to Dr. Satterwhite talk a little bit about what happens in the ICU with COVID-19. His wife is Dr. Catherine Satterwhite, and she's the Regional Health Administrator for the Department of Health and Human Services. She's going to be joining our conversation to talk about how we stay safe this fall and the bigger challenges of things, especially as that we reopen schools across the way. Chiefs Arrowhead opens up, so football is going on. So things like that are also important. And also, say hi to Sarah. That was who was on the Flint Hills Trail just a moment ago. She says she doesn't usually need a mask when she's out on the trail, but she always has one just to be ready in case. Remember to send us those mask photos. You can include reasons besides safety that wearing a mask is useful. Remember that song, 50 Ways to Leave Your Lover? Just sneak out, what is it? Walk out the back, Jack, make a new plan, stand, all those terrible things, right? Well, now we're going to talk about 50 ways or 50 reasons to wear a mask, like bad breath day, or I missed with the lipstick, or terrible razor, zit on my nose, stuff like that. We want you to write in and talk to us about the 50 reasons you think you should wear a mask. Hey, this has been great. I always enjoy having Dr. Erin Corriveau on the program. She does such a great job, Deputy Medical Officer, United Government. Thanks, Erin, for coming back with us today. And a special thank you to Pastor Glenn Brady of the New Bethel Church in KCK, who's a great community steward, does such excellent work here in Kansas City, Kansas. You know, one of the things I liked about today's program was we talked about how grace, wisdom, hope, love, and things like that help lead us through a pandemic. And yes, science too. And you know, we can all walk together. And the closer we walk together, the better our walk becomes. And the easier it will to get through the pandemic of 2020. We'll be walking here tomorrow. We hope you're back with us and join us again. Remember, there's still no place like home. See you tomorrow.